Okay, hi everyone. I'm Phil Glovich, Associate Professor in PFRH, and really pleased today to have the opportunity to welcome Dr. Susan Newcomer. Before I proceed with an introduction, just want to make sure everyone on Zoom can hear and see. Let us know in the chat or send us a message if not. Susan comes to us from the NIH, but prior to that, Susan got her PhD in sociology and pop studies at UNC. And then afterwards, after spending a year at UNC, she moved on to become the National Director of Education at the Planned Parenthood Federation of America. So she has extensive experience, not just from NIH, but from outside as well, in areas highly relevant to us. At the NIH, she served for 25 years as a senior administrator and oversaw a grant portfolio of over $42 million worth of grants during that period. And these grants ranged from domestic and international, and on a range of topics that are near and dear to the hearts of people in Pop Fam and the HPC, like contraceptive use, contraceptive dynamics, HIV, family planning, and fertility. And some of the grants that Susan mentioned are now like high profile, very well known, and esteemed projects that are long-standing. So overall, in short, we're really fortunate to have Susan with us because not only does she have extensive experience in topics of interest to all of us here, but she knows the NIH system very well and can help us to navigate the grant system at NIH. So we're very, very lucky to have her here. Want to also thank HPC for support for this, as well as PFRH, and especially Dina. I'd ask that everyone on Zoom, please hold your questions to the end. We'll have, I think, ample time for questions and answers. So thanks again, Susan, for joining us, and over to you.
Thank you, and thank you for your support. I like to describe myself as a sexpert bureaucrat. That's when you get all these registrations to join on a Zoom call for something or other, and it says the name of your position, and I put in sexpert bureaucrat. Nobody yet has said, now, Susan, what is that? But that's what I am. And what I'm going to say is basically all cribbed from the NIH websites, various center websites, which have all this information. It's just a matter of figuring out where it is and which buttons to push. So that's what I'm going to talk about. And I think my email is at someplace in this. And at any rate, if you have a question that you don't think about today, but you think about on Tuesday, I'm pretty good on answering emails. Sometimes I'll say, I have no idea, but I might be able to help you. So do not be shy about calling in or emailing me and asking a question. I love to do it. It's as I said, it's my missionary position. So this is the U.S. Department of Health and Human Services, which has a bunch of different branches. Notice that there's the Centers for Disease Control, and then there's the NIH, both of which provide grants or contracts in areas that you all are interested in. This is the NIH, which is the largest public funder of biomedical research in the world. It really is. Something like, and this is the NIH. These are all the different institutes at the NIH, each one of which has its own climate and culture. And each division or each institute has some people who do social and behavioral science. So depending on what you're interested in, there's usually somebody at the institutes who is interested in social, or at least marginally interested in social and behavioral science. Then there are also a couple of smaller offices. The Office of Sex and Gender Minority Research, they just issued a call for studies on redefining sex and gender terms, which I think it was a one-time call, but so they are interested in the issues around sex and gender minority and LGBT issues and transgender issues. They're not an institute, but they do have money, and they have transition money that helps fund ongoing grants. So it's an interesting place to look for research. And then there's the Office of Behavioral and Social Science Research, which was created begrudgingly, maybe 15 years ago. Yeah, well, all right. Yeah. People, what they do might be as important. I keep arguing, genetic zip code is a better predictor of behavior than genetic code. Well, not really, not for the NIH anyway, but this is the office. And so they are interested in listening to comments and suggestions, but they don't have very much money. They're just a little nudging place. And then there's the Office on AIDS Research, which was started right at the start it was started as a small thing, and it's now gotten much bigger, of course, through the whole AIDS epidemic. But it also issues calls for research still, but it's still more in the biomedical issues. So how do we decide what to fund? They said the mission is defined in law. There's a yearly appropriation bill, so every year the NIH has to go beg for money. And we report to and of course the media and who knows who else report to the Congress. And of course there are lobbying people at the NIH who basically lobby with Congress or respond to congressional issues. So the NIH continued funding is a function of success. And therefore success depends on you. Also, the NIH needs you as well as you needing the NIH. So do not be shy. The budget process is convoluted, as all budget processes are, but there was $62.5 billion to the NIH in fiscal 2022. Lots of money. And 90% of that will be for extramural research. That is not research, contract research at the NIH. That is out into the institutes, out to the universities and other research organizations in the world. There's a lot of the money is committed because we give 2- and 5-year grants. So a lot of it is committed, but there's always room for a new and good idea. So within each institute, there are usually centers, divisions, branches responsible for specific research areas. And my parochial perspective is really on the demographic and behavioral sciences, the population dynamics branch within NICHD, basically sex, demography, babies, family planning use. And so I was one of those, at that point, 6 people who were in that branch. And now basically Rana Popkin is the person who took over from me as a expert bureaucrat. Then each institute also has an advisory council, sort of like the board of directors. And it also has an intramural research program, which is maybe 10 or 11% of the grant money to an institute goes to the intramural. By and large, that is biomedical research. The NICHD has a small intramural grant contract division, but basically they do contracts and they don't talk to the rest of us. So I don't know very much about them. If you're thinking about a postdoc position, that would be an interesting place to go work. And yes, as you all know, the NIH does fund research outside the United States. We fund not only US organizations with research interests outside but we also fund some outside non-US research organizations. By and large, I have been told apparently that the global South is no longer an appropriate term, but we're more likely to fund a Kenyan research organization than one in Cambridge, England, because the English don't fund our research, so why should we fund their research? But there are grants awarded specifically to international organizations. The Fogarty Center is the little part of the NIH that actually manages and monitors our dollars overseas. They're also the people that manage and monitor people from the NIH who go overseas. You can get a diplomatic passport, but it's kept in a drawer at Fogarty Center. You got to get it when you go on a NIH trip someplace. Then the mission is the NICHD mission, which is what I can tell you. Every person is born healthy and wanted Women suffer no harmful effects from reproductive processes. That's like exposure to the risk of a fertility event. We don't say sex. And all children have the chance to grow and develop to the best of their abilities. And the NICHD has a fairly large portfolio of research on children and disabilities. But it's really hard to get NIH money. It's incredibly competitive, but you control it. And there are a few, but very specific grant requirements. And you are blessed at Hopkins to have research management people who understand those. Because I am, right now, I was telling people, I am trying to help Chatham County, North Carolina, apply for an Office of Population Affairs grant. And I don't think they can do it because their budget department just doesn't have the capacity to do the kinds of budgeting and staff management stuff that the NIH or that even the Office of Population Affairs requires. And you also get really good input from wise people about your stuff. And it's, of course, maybe it's not like getting a MacArthur grant or something like that, but it's fairly prestigious to get NIH money within your field. So then these are the sort of categories. And again, on the website, you will see lots more. The research grants for individuals, the R01, that's the big one. That's the $500,000. If you want more money than that, you have to basically beg and beg and beg. The R03, which is little grants, the R21, which are experimental grants, two years usually, and then the R34, which I know very little about because my branch never funded them, but they're cooperative. Then there are the training grants, some of which you all know about. There are F31s and F32s for pre-doctoral students, the K01 for a postdoc, we've lovingly known as the kangaroo, the K23 for clinical research is the K01, and then there are the institutional training grants that start with T. And I think Hopkins has some there. The branch has about, I think, 15 institutional training grants at different places around the country that fund the POP centers pretty much. And there are center grants for all kinds of other research too. And they basically fund the administrative infrastructure for you to get the advice and assistance in writing a grant application. So, and then there's the Small Business Innovative Research, SBIRs. If you have, this is for for-profit small businesses. If you have one of those making, say, cannulas for menstrual extraction, which is one of those that was started a long time. Every branch of the federal government has these SBIR grants. They are much less competitive than the regular grants, but you do have to have a small business. So you have to have at least 51% of your time as chief of a business. The business can be you in your garage, but it's a business. So those, if you've got a really neat idea to develop something, probably not a new contraceptive method, that's a little bit more complicated, but some kind of mechanism or something, think about the small business grants. Now, so this is where you find out what's already been funded. The reporter, which is one of the NIH services, the web service, you can keyword search it by institution, by subject. Be careful what you ask for. Research on sexual behavior. You get 2,000 hits. This is everything that has been funded since Reporter was started maybe 30 years ago. And you'll get the abstract and then the contact. So you can always call somebody up or text somebody or email somebody and ask, would you be willing to share your grant? If you want to get the grant application itself redacted, it will take you 50 cents a page and a long time to get the grant. But you can always call up an investigator or contact them and say, would you be willing to share? And many times a researcher will be willing to share the grant. Okay, and this is what the NICHD is interested in. I still think it's my branch, is interested in funding fertility, mortality, morbidity, and health. Of course, that slides into the NIA, who are more on the morbidity and mortality, except for maternal mortality, migration, household structure, marriage, cohabitation, demographic methods, methodologies, and behavioral research on STDs and HIV. NIMH is also interested in that kind of research, as is you don't have to be crazy to have sex, obviously, but NIMH is interested in sexual behavior research. And as is NIAID, but more on the biological spread of disease. Population and environmental issues are complicated, and we do fund some research in that, but the definitions are challenging. And childcare and other things as well. So, and then there are special funding initiatives. There's an RFA, request for applications. That is somebody at the NIH gets a really good idea. We haven't had no funding, no research on X for the last 15 years. I'm going to ask for $3 million a year for 5 years to fund research on X. And trying for, that is a challenge for us to get permission to specifically set aside money for topic A. And sometimes when you issue one of those, you get 700 applications for $2 million a year. Sometimes you get 3, but they are very interesting and they are very targeted, very focused. And then the program announcement, which is sort of, yo, folks, we're interested in this. And there's no money set aside. So the applications go to the standard study sections and you're competing against everybody else. And they are also how the NIH reminds people that we are interested in this or that or the other thing. Now, right now, interestingly enough, reading an FOA, reading the line, the information between the lines, my branch has just issued an FOA calling for research on how policy changes affect populations of interest to the NIH. I read that as, so what is Dobbs doing to abortion? But you read that 4-page FOA, nothing about abortion, nothing about the Supreme Court, nothing about reproductive health, but it's there. And the point person on that one is the person who replaced me, who's the sex person at the branch. So read an FOA and think about what's going on in the world at the moment, because this is responsive to, well, I called up the current branch chief and I said, I'm going off to do missionary work. What can I talk about? And she said, talk about this. She didn't even mention the word abortion on the phone with me, but she knows it's there. So remember, relatively few applications are funded through these RFAs, these special funding initiatives. Pretty much, it's you get a good idea, and you submit it. And before you actually start spending time, money on applying, I say talk, but I mean email the NIH staff. Look on the web and look at what's been happening, and email with somebody about, I'm interested, not a 4-page thing, but I'm interested in research on how abortion, how different states in the United States are responding to these changes in abortion laws, something like that. And then you also check out the website to make sure you're going to the right institute. Some things there are it's discrete jostling. It's mine. That grant is mine. You know, maybe he's working on this now, but he's got lots of money from us. We want that one. We like to look good too. So it's skill. Grant writing is. I think the budget and the financing part rely on your office's sponsored research, but in terms of the substance of what you want to do, it's a skill. You can learn it. You can, and it'll be useful other places as well, even though the format may be somewhat different. So you know your strengths and weaknesses. Don't chase after something, an RFA that looks sort of interesting, but you don't know squat about it. Don't waste your and your institution's time on that. Don't change directions just for an RFA, and don't promise more than you can deliver. No amount of grantsmanship can disguise a weak idea, but boy, sloppy stuff can kill one. So follow the directions, follow the directions, follow the directions. Even if they seem weird, follow the directions. And persuade. This is marketing. This really is marketing. and explain what you're going to do and why you're going to do it that way. Don't assume the reviewers will know what you mean, because they might want to make sure that you know what you mean. You're not just using buzzword, 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 but you know what you're doing. Why you want to do it. Why is it important? Why are you doing it this way? I mean, almost to the point of, if you're studying prostate cancer, you say prostate cancer only occurs in men, so we're not studying women. You have to justify why you have included, who you've included. And these days with, or anybody with a penis or anybody with a uterus, well, there are a lot of women without uteruses. So, be careful that you justify who you're working with, as well as why you're doing what you're doing. This one, I like, this is an old cartoon. I don't know whether you can read it, but it says, formula, 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 then a miracle occurs, formula, formula, formula. You need to be explicit about what it is you want to do. And unified, 2 aims, maybe 3, no more than that for an RO, and 1 for some smaller grant. Not, I'm going to save the world. You're not going to save the world. And explain it logically. Follow the directions. Don't inflate the budget. Well, don't inflate the budget blatantly. Of course, because you're going to get cut. No matter if you get a grant, and if you get a superb score, you're going to get cut. So squeeze in a little extra here and there, realizing that you're going to get cut. But don't go cheap, because if you go cheap, the reviewers are going to say, this person hasn't got a clue about how much it costs to do a 500-person survey. So don't minimize. Cheap will get you nowhere. Keep in mind who's going to be reviewing it. You can look on the websites for rosters of recent study section. Reviewers sign on for a 3-year term as a reviewer on a standing study section. So their names are on the web. For a special RFA, the Center for Scientific Review pulls together people who have expertise in that particular topic. But for regular, the 78% of applications that come in just over the transom, they go to standing study sections. You can find out who they are. Then just don't irritate the reviewers. Remember, they have got, each one of them has maybe 25 or has 8 grants that they have to write complex reviews of, and they get the whole 60 or 70 grant applications that come in. Don't piss them off. It does not help. Remember, strengthening why yours application is good, why you're going to do it. And if you've got preliminary data, include it. And then say, and then after this, if it comes out, I then intend to go on to do just for a training grant, for a first grant. Save the snappy title for your publication, not for the application. And then the abstract, write it last, because you might have one at the beginning, but write the abstract last, because those researchers or reviewers who get your grant, they may not be assigned to review it, but they will look at the abstract. So make it include, and then you write a cover letter. I think this should go to, I think this should go to study section thus and such, and I've spoken with somebody at Institute thus and such. So it seems to me that it will go, and that saves the Scientific Review Center time and effort, because then you can go there and you can suggest the kind of expertise, but you don't name, unless you really and truly don't want somebody to be on the review, then you can name that person. But don't name a reviewer. Although if your ex-husband's second wife who cheated on him with you, cheated on you with him, you can say, if there are 1 or 2 people you really don't want to review it, you can say, would be preferable if so-and-so and so-and-so do not review it. You can't list 14 people, and it pretty much has to be a deep, profound disagreement or a personal issue. It's not because I don't agree with him or because I'm trying to correct what she did, but you can ask for certain people not to be on your study section, on a review of your grant. There's no grantsmanship. Well, I named this as innovative, and I had five, in aims. You can't do that. No, there's no grantsmanship that will turn a bad idea into a good one, but there are a lot of ways to screw up. So this is another one of my very old ones. They really, having sat in on a couple hundred reviews over the time, the reviewers are good. They do a good job. So these are, logic, focus, details, too unrealistic, or what are you going to do next? Those are really common problems in applications, not just from new people. And don't self-censor. Don't say, oh, they would never fund this. Have you applied? Well, it's like complaining about your congressional representative. If you didn't vote, you have got no voice to complain. You've got to try. It's a two-level. First is the reviewers that everybody talks about, the review committees, the study sections. And then the second is the advisory council for your institute. Gets all the things that we'd like to fund. 4 times a year they meet, and they look at the sort of general portfolio. And sometimes they will ask a question. Pretty much they just say, well, all right, you're the pros, you know what you want to fund. Yes, we think that's a good idea. Sometimes they complain, but by and large, I won't say rubber stamp, but they look at and keep an eye on what's going on at the Institute. Aren't you funding an awful lot on family planning and nothing on maternal mortality? They'll say questions like that. So this was a long time ago, because now reviews are digital, but this is back when the reviewers would get a big box full of applications. So you can see the cardboard boxes. So when a particular review is over, you hear a great thump as everybody throws that application into the recycle box. So the thump is this, the sound I remember from study sections. Okay, the reviewers are based on their expertise, on if they've reviewed before for the NIH. And there are some people that, oh yeah, well, he really knows what he's talking about, but he's a pain in the ass in a review. So if the dynamics of putting together a study section are complicated and delicate, the Center for Scientific Review does a pretty good job of it. So previous review experience, all of those things go into who gets chosen to be on a standing study section, and they do get paid. Not a lot, but they get logistics pay and I think $100 a day, but only for the 3 days they're there. The Center for Scientific Review is always looking for reviewers to recruit in to become reviewers. So it is, even if you don't have an NIH grant, but you have a special area of expertise, you can be invited to review, and basically it's a trial. Oh yeah, she's really good. She listened to everything. She had good questions. Or, oh, for God's sake, he read the New York Times through the whole review. The reviewers, the review administrators look at that. And so they evaluate how to make a good mix of people to review. But it's definitely worth doing. Each reviewer gets maybe 8 applications. They review, and then they write reviews for each of those, giving it a score. And there are 5 criteria. They're just in the process of changing in a sense, but language is delicate. They're changing, but it seems to me they're going to remain pretty much the same kinds of issues. And then the reviewers meet all together, and I think they've gone back now to pretty much in-person meetings rather than Zoom meetings. And half the applications do not even, they get reviewed and you get a written review, but they don't get scored. And therefore they don't get discussed in the meeting. The only the ones that are probably in the better half of the pot get reviewed and discussed and reviewed. And the review process is in the process of being simplified somewhat. The scores will remain the same. The factor 1 will be significance and innovation. Those used to be 2 factors. Factor 2 will be feasibility and rigor. And the reviewers are going to basically if it's okay, they don't have to write about it. They just, if there's a problem, then they've got to say, we don't think they can do this because of A and B and C. And so they are expertise and resources. Again, your Office of Sponsored Research has a template that can give that. And if it's okay, the reviewers will say it's okay. And if not, if you're a small organization or something, we don't know whether they can do this. They have not justified it very well. But basically it's the same kinds of things. And as I say, read the directions. The third factor is sort of factor 3, the institute and so forth. There will be, yes, it's good, or no, it's not good. So then significance, innovation, approach, how are they going to do it? Investigator, can this person do it? And of course, the more you're asking for, the more complicated that one gets. And the environment, does the environment intend, will it be good? So those are the issues. Then there's a human subject protection. And that's even if you're using secondary data, you've got to say, these data were collected in, this is going to be protected this way and so forth. No matter how, you have to talk about human subject protection. And the inclusion of women, minorities, and individuals across the lifespan. Again, if you're talking about reproductive health, you might have to say, we are going to only interview people between the ages of 18 and 49. And then they're going to say, well, why aren't you including children? And you've got to say, why? Why not? Why the under 18s are excluded? Then also ditto for, and since I've never had anything to do with it, vertebrate animals, biohazards. And then if you're resubmitting, there are questions about how you responded to the first review. And then the budget. So data sharing is, and I have not read the implications, but apparently the requirements for data sharing are now, used to be that it was big data. If the NIH was going to spend $1 million a year collecting collecting data, those data had to be available for other people to look at as well. Well, now it's even down to, if you're doing focal group, small, things with a few number of people, you have to be willing to share the data. And so that's another place, read the directions. You rely on your Office of Sponsored Research as well. This is another thing that Rebecca, our current branch chief, said, pay attention. She said demographers are used to that, but other people may not be. So then you get a priority score from 1, which is excellent, to 9, which is perhaps you better go study slime molds or something else. So low is good, high is not good. Yeah, if you don't get funded, try again. Everybody's had something blown out of the water, everybody. Even if you don't succeed, you will have a well-developed idea of go to pitch it someplace else. And criticism is always difficult. But if you get when you get your review, I used to say, throw it in the drawer and come back to it 3 days later. File it and come back to it in a couple of days, and then go through. And they don't tell you how, they say what's wrong, but they don't say how to fix it. So you've got to do that yourself. You got to consider your options and justify your decision. You don't have to do everything they say you should do. You have to at least acknowledge that they said it, and then say, perhaps we were not clear in our explanation of. You don't say so-and-so never read the damn thing. You mind your civility in that. Talk with the program officer, because she or he probably sat in on the review, and sometimes things don't get written down, but they're there. So talk or email with your program officer, who's there, who will be signed. Even if you sent it in over the transom and didn't talk to somebody, there will be somebody who is assigned as a program officer. So consult with that person about whether you, she, they all think it's worth revising. And these are basically the places on the NIH which have the kinds of information you need in order to write a successful application. So this is, I am no web designer, but good idea, brilliant proposal. Your institution submits it. The NIH reviews it. You get funding, or you have to revise and resubmit, or you just give up. But I recommend that you try again. So that's, you know, as one of our former directors said, there's always room for a good idea. So that's what I have to say, and I will be glad to answer questions. You have the chat questions, right?
Not yet.
Not yet. Yeah, well, all right. You might want to come speak at the microphone, because that way the people, those people can also hear you.
Well, thank you so much, Susan. This is all. I'm already pretty loud, but.
Well, it won't
Make sure everyone can everyone hear me on the Zoom?
I am going to see.
Well, anyways, okay, thank you, Sally. So Susan, thank you so much. You know, it's really helpful to put all the bits and pieces I learned through, you know, over the years together. One quick question I have for you is the, you know, notice of award. Well, the time between impact score and notice of award is such a lengthy, but also varying, like, you know, the time could really vary depending on, you know, the budget appropriation. So I guess, you know, can you comment on, like, what's the distribution of that factor in general? And I mean, like, you know, as soft money investigators, we all try to optimize this, you know, constant grant submission processes, you know, so I'm still learning to optimize that. But, you know, that's like a big factor, right? If I have R1 pending, I may not want to write another 2, you know, grants. And if the, you know, grant comes through, I can't really, like, you know, manage all 3. So can you just comment on that distribution,
Well,
perhaps?
part of it is variable by institute. Part of it is variable by, I hate to say it, but the political climate that, that people worry about the impact of this versus that, and how, but it is a pain, and there's no controlling over it, unfortunately. And another thing is, as I said it earlier, when you're writing about budget, inflate because you're going to get cut no matter what. I mean, and sometimes it is a challenge. If you get cut in half, can you still do at least some of what you wanted to do? And that's a decision that you have to make. I have a friend who is suffering because she got a grant, she got a good score, and they cut it. And so, and now she really can't do it, but she signed on to do it. And it's difficult. It's a difficult situation, but yes, grant award pending. By and large, I think that if the second level of review says, yes, we should fund it, it's going to get funded, but it may not be for another 6 or 8 or 9 months before the actual money shows up in your institution. There's no, basically there's no telling. It's just grin and bear it. You have to suffer. Suffering will make you beautiful.
Susan, I actually wanted to follow up on that, because I think a lot of us have been in this circumstance before. Between the time when, like, the advisory panel approves it or gives it the stamp or whatever, and when you see the funds, what takes place during that process? What's the NIH doing?
The NIH is digesting it along with all the other things that came in that month, and sorting out within the institute. Pretty much this is because an institute gets a certain amount of money. So they only have that much money to spend. And so there's internal squabbling about between the various and sundry branches or centers about, well, yeah, it got a very good score, but that went over and the child development and behavior branch got a better score. So does that mean that they need more money than we do? Part of it is internal squabbling. Part of it is realistic, pragmatic planning. And part of it is just understaffing and overcommitment. So it's a whole, I can't say it's A through K of things that are happening. You can not every day, but you can talk to the program officer, and she or he might have somewhat of a read, but sometimes it's the Office of Grants Management within the within your institute, which is squabbling over who gets what, which proportions of what amount of grants. But it is a pain. But if you got a fundable score, eventually you will get funded. But maybe not until after, after your car payments are due and God knows what all, but it will happen. All right, more questions? Yeah.
Yeah.
Can you pass?
So, is it?
Yeah.
Thank you so much, Susan. Thanks so much for being here. This is so helpful. I wondered if you could tell us more about the mechanics of the offices and the institutes and how they work, knowing that sometimes our research priorities or ideas are very closely aligned with an office and then also with an institute. But my understanding is that offices don't fund directly. You used the word nudge. Can you tell us about how that works in terms of our offices funding directly? Or are we making the case to align the office priorities with the institute?
Well, part of it is most of the, I think the section gender minority, the Office of, it used to be the Office of Minority Health. Basically we program people, made pitches to them and acknowledge that they have important stuff to say. And so part of it is basically personal interactions. It really is. But part of it is that the Office of Sex and Gender Minority has umpty million dollars that they can spend over the year on their issues. And so we can say to the people that we all, of course, cultivate our relationships with the people in this, we can say, look, this one is really important. I think that you should fund it. So part of it is the base of it is what you've said, is what you and your application have said about what it is you're doing. And then part of it is our persuasiveness to that particular smaller organization, which might, really, you said you want to do X. Here's a great opportunity to do X for this grant. Why don't you just put some more money into it? Sometimes, of course, the institute or the small person will put in some money. And so the NICHD grants management will say, okay, well, we'll just cut our amount, the amount of money that we're giving them, because the Institute for, the Center for Social and Behavioral Science is giving another $50,000. So we'll cut out our money. Sometimes it's all not exactly personal relationships, but they feed into it.
Well, that's so helpful. As an investigator, do we know what the co-funding situation is, or is that just behind the?
Well, you can make suggestions of what you think should happen, and as it doesn't hurt. And if this is of interest to the Office of Social Behavioral Science Research as compared to their most recent mission statement, and therefore that gives the program officer some more ammunition to go talk to OBSSR, say, look, really, this is something that you said you were interested in. Come on, come through. But there's no guarantees in any of this.
There's a question from the chat. What score is considered fundable?
What score is considered fundable? Well, a 1 is pretty much considered fundable. And then again, it depends from that, what the mix is in that review site, what kinds of ongoing obligations that the institute, the branch has at the moment, what kind of allocation that particular institute or branch managed to get this year. A 1 is pretty much, and then it also depends on what came in that round. If a whole bunch of superb applications came in and a whole bunch of 1s were awarded, then your likelihood of being funded without cuts is not very good. And that is chance, that really is chance. And if that particular round of applications and review came in and there were a lot of mediocre things and you get a 3, or it sings to the specific desperate right now program needs of a division or a branch, then it might get funded. But I can pretty much safely say that if you get a 1, you'll get funded. But if you get a 1, you can also walk on water. So the odds are very, very, so a 2, a 3, maybe, depends on a lot of these issues. Anything worse than a 3 will be revised and resubmit. And all of the grants that come in for a given round, all the applications that come in for a given round are given scores, and then the score, how the score distribution goes across the institute sometimes plays a line in how far down we can fund to the 10th percentile, or we can only fund to the 6th percentile. So the mix of grants that come in and then the scores on the grants play into it, but it is institute and timing and cycle dependent.
Hi, this is
Unfortunately.
Arik Marcel from online. Can you speak to, especially for the more junior investigators, what's the best timing to connect with a project officer, an idea? Is it best to have like a fully fleshed out Ames page, or
No,
something more?
It's best to have a 3-sentence email with this person, because that way, if the program person can say, yes, that's right on target, or actually, did you know that NIMH is interested in that? Why don't you talk to so-and-so? Or no, I don't think this is not the time to apply for that. So 2 or 3 sentences, no more than that, and expect a week or 2 before a response. Then as you get along, maybe some more, but remember, for every award that we have, there are 15 or 20 people who also want our information about, what do you think about this? So it's going to take a while. And also there is the delicate dance of how much a program person can actually say or write about, as I said, Rebecca Clark's funding opportunity announcement about legislative changes and their impact on persons who relevant to the institute. There's only so much they can say, so you've got to do some reading between the lines as well, even in a phone call. I hate to say it, but it's true.
Thank you.
Yeah. The what? That one I don't know about. So look, type it into the websites and find out, because I don't know anything about them. Sorry. Yeah.
I know there's many people in here who do global health research, and you kind of touched on, it doesn't matter if it's international or global health, or I'm sorry, domestic or international, but I think a lot of people have said you have to make your global health research applicable domestically for it to be more competitive. So do you have thoughts on that, or how to make the international applications better?
I don't think that's necessary. It's helpful if you can, but if you stretch the truth about issues around the impact of Ebola on future reproductive health, which is indeed an important issue, and you say, and this will be helpful to the United States in thus and such, they're going to say, where does she live? Or where does she get that idea? So sometimes if it's feasible, and if you can make a point, then do it. But don't feel you absolutely have to put a paragraph in about it. And, in a sense, you might want to say something about interest in the way that disease tracking is done in other countries compared to the United States. I mean, I've been reading some stuff about the CDC basically blew it in terms of disease tracking with COVID, and needs to get their act together better. Maybe you could say that I very much doubt that some other country does a better job of it, but they might. So those kinds of, don't feel that you have to stretch your research, because as I said, the NIH mission is to improve global health. Yeah.
Send out an RFI, and I haven't really seen that before.
A what?
A request for information. Talk a little bit about like what those are used for.
They are used to justify developing a funding opportunity announcement. Because the NIH knows, in effect, what they're already funding, but sometimes things get trendy and lots of people come in and get funded, but that does not, but if there's a new issue, like back as AIDS was starting, nobody knew squat about sexual minority populations. So there was call for information on that. And I would imagine that there are more of those kinds of, and of course, getting permission to issue one of those is a matter of politicking and persuading even within the NIH. So basically, if there is an RFI and you have an interest in that thing, put your 2 cents in. If you don't, it might not get considered. And they do read them and pretty much count up, all right, there's this and that and this and that. And these are the people who seem to be most vocal in writing about it. Maybe we can get in touch with them further. Any others? Nope. Well, as I said, susanfnewcomer@gmail.com, and I will answer, or I will try to answer. And I will probably also report back to my branch about they're really interested in X, for what that's worth.
Yeah, thank you.